Ever feel like your desire for intimacy, it's not always a constant thing.
Yeah,
Life gets in the way, right?
absolutely.
Stress, hormones doing their thing.
Yeah.
It's like that spark just kind of dims a little. Sometimes even fades out completely. I bet a lot of people listening can relate to that.
Oh, definitely. It's super common, like a normal part of the human experience, really. It's when that dip in desire sticks around,
Yeah.
becomes a pattern, something that's causing you real distress or even affecting your relationships. That's when it might be hypoactive sexual desire disorder.
HSDD. So that's what we're diving into today. And usually when we think about low sexual desire, we tend to jump to hormones, right? Or maybe psychological stuff, relationship dynamics. But today, we're taking a different route, exploring something that might not be so obvious, but it could be just as important.
Okay, I'm intrigued.
We're talking about vaginal health, its role in all of this.
Ah, interesting. I see where we're going with this.
May seem kind of unexpected, but when you think about it, it makes sense.
It does, yeah.
A healthy vaginal environment, that's the foundation for comfort, feeling good about your body, and having positive experiences with intimacy.
And you got to feel good to want to do it.
Right. But when things are off down there, whether it's infections, dryness, inflammation, well, that can really get in the way of intimacy.
For sure, it can create a mental block, even if you don't realize it.
So today's deep dive, our mission is to explore this connection.
Love it. Let's get into it.
Vaginal health and sexual desire. How are they linked, and how can imbalances down there be connected to HSDD? Because ultimately, we want to give you some new ways to think about bringing back that spark.
That's so important. So many people struggle with this silently.
Let's start with the basics. What exactly is HSDD? How would you define it?
So basically, it's a persistent, ongoing lack of those sexual thoughts and fantasies, or even just a general interest in sex. And it's important to note, it's not just a one-time thing or being tired one night. It's something that's causing you genuine distress or leading to problems in your relationships.
It's about the impact it's having on your life, really.
Exactly. And there's so many factors that can play a role.
Like what? What are some of the common culprits?
Our sources point to a few big ones. Hormonal changes are a major player. Menopause, postpartum, even some underlying medical conditions can throw your libido for a loop.
Makes sense. Hormones are powerful.
Then there's the psychological side of things. Anxiety, depression, issues with your partner. Those can all dampen desire. Certain medications and medical conditions like diabetes or thyroid disorders can have an effect too.
It's complex, for sure.
And let's not forget about physical discomfort or pain, chronic pain in general, but specifically vaginal dryness or those pesky recurring infections.
Those are the worst. So we've got hormones, psychology, physical factors. It's a lot to untangle.
It is. And while most approaches focus on the hormonal and psychological aspects, it's fascinating to consider vaginal health as another crucial piece of the puzzle.
Right. It's like another angle to approach this from.
Exactly. If you're not comfortable and you're dealing with constant irritation or infections, that's going to affect everything. So by prioritizing that, by making sure things are balanced and healthy down there, we might find another way to improve our overall relationship with intimacy.
Okay, I'm following you. But let's break it down further. How exactly does vaginal health, or rather the lack of it, contribute to low sexual desire? What's the link there?
Think about it this way. Healthy sexual desire, it often comes from positive reinforcement.
Like a feedback loop.
Exactly. Pleasure, feeling good in your own body, confident, those all fuel the fire. But when your vaginal health is compromised, sex can become, uncomfortable, maybe even painful.
Ouch, yeah. Not exactly a recipe for wanting more.
And then you might find yourself constantly worrying about another infection flaring up. It takes away the spontaneity, the fun.
So it becomes a mental hurdle as well as a physical one?
Exactly. And over time, this avoidance, whether it's a conscious choice or not, can really reinforce that lack of desire that's at the core of HSDD. It's a cycle, you see.
A vicious cycle. Okay, so let's get specific. What are some of the ways vaginal health can directly impact libido?
Well, first up, let's talk about vaginal dryness and the discomfort that comes with it. That's a huge one.
Yeah, that sounds like a major roadblock. What are some of the reasons behind vaginal dryness?
Low estrogen is a biggie. It happens during menopause, after childbirth, or as a side effect of some medications. And get this, stress can actually dry you up too.
Wow, stress really does mess with everything.
It really does. And the impact on desire is pretty straightforward. If sex is consistently uncomfortable, itchy, or even painful, that's called dyspareunia, By the way, it's going to make you want to avoid it.
Makes total sense. Nobody wants to associate sex with pain.
Right. And then you have chronic infections and inflammation. Those can really take a toll on your desire.
Oh, I can only imagine.
Think about it. The constant frustration, discomfort, and just the disruption to your life when you're dealing with recurring bacterial vaginosis, yeast infections, UTIs, it's exhausting.
I bet. Just the thought of it makes me want to crawl under a blanket.
It really can wear you down. It affects your body confidence, your stress levels go up, and of course your sexual appetite takes a nosedive. Who wants to be intimate when they're feeling icky and worried about discomfort?
No one. So we've got dryness, infections. What about the vaginal microbiome? That seems to be a hot topic these days.
Oh, it's super fascinating. The vagina has its own little ecosystem, a community of microorganisms. It's called the vaginal microbiome. Ideally, it's dominated by good bacteria, specifically lactobacillus.
Lactobacillus, I've heard of that.
They're essential for maintaining the right pH balance, slightly acidic, which acts as a natural barrier against all the bad stuff, harmful bacteria and yeast.
So it's like a little army down there, fighting the good fight.
Exactly. But what happens when that balance gets thrown off?
Uh-oh, I have a feeling this isn't good.
Well, lots of things can disrupt it, like hormonal shifts, stress, even your diet. When that happens, the levels of good bacteria, the lactobacillus, drop. And that opens the door to all those imbalances we've been talking about. Dryness, weird odors, unusual discharge.
Not fun.
Definitely not. And then you add the self-consciousness, the worry. It's hard to feel sexy and spontaneous when you're not feeling confident about what's going on down there.
Right, it's all connected. You mentioned earlier the importance of emotional well-being and confidence in all of this.
Absolutely. Sexual desire isn't just physical, right? It's mental and emotional, too. How we feel about ourselves, our self-perception, all of that plays a huge role. If you're dealing with constant discomfort in that area, it can create anxiety around intimacy.
You start to associate it with negative feelings.
Exactly. And you might start avoiding it, maybe even without realizing it. And as we said before, avoidance is a hallmark of HSDD.
Okay, so we've established this clear link between vaginal health and sexual desire. It's a connection a lot of people might not even think about.
It's often overlooked.
So what can someone do about it? What are some practical steps to improve vaginal health that could have a positive ripple effect on libido?
It's important to remember that HSDD is complex, and often it's about addressing multiple things at once.
Like a holistic approach?
Exactly. But optimizing your vaginal health is a really tangible, empowering step you can take. It can make a real difference.
I like that, empowering. So where do we start? What are the basics?
Well, nutrition and lifestyle are a great foundation. Think about a balanced diet, rich in antioxidants, essential fatty acids.
Healthy fats, good stuff.
Yep. And phytoestrogens, which you can find in soy and flaxseed. Those can support your hormonal balance and the health of your mucous membranes, including the vaginal lining. And of course, staying hydrated is crucial.
Water, water, water.
Exactly. It helps with tissue elasticity and overall comfort.
Makes sense. What about exercise?
Regular, moderate activity is amazing. It's not just about overall health, it also improves circulation, including blood flow to the pelvic area.
Keeping things moving.
Exactly. Enhanced blood flow means better support for natural lubrication and tissue health. And stress management. That's huge. Chronic stress throws your whole system out of whack. It weakens your immune system, messes with your hormones, and definitely impacts libido.
Stress is the worst.
It really is. So finding ways to relax, whether it's yoga, meditation, spending time doing things you enjoy, that's all going to benefit your vaginal and sexual health in the long run.
Self-care is healthcare, as they say.
Absolutely. Then there's hygiene, but with a gentle approach. Using fragrance-free, mild cleansers is key.
Ditch the harsh stuff.
Exactly. And no douching. It disrupts the natural balance of your vaginal flora. Clothing matters too. Breathable fabrics like cotton for underwear and avoiding super tight clothing can help prevent moisture buildup.
Good tips. What about when infections do happen?
Early detection and treatment are essential. If you notice anything unusual like discharge, odor, persistent irritation, don't wait. See your doctor right away. Catching it early can prevent it from becoming chronic and reduce the chance of those annoying recurrences that really get in the way of intimacy.
So don't suffer in silence.
Exactly. And overall, supporting your immune system is key. A healthy lifestyle gives your body the tools to fight off infections.
Makes sense. We've covered lifestyle, hygiene. What about more targeted interventions for vaginal health?
Hormones can be a factor for some women. If you're dealing with low estrogen, which can contribute to dryness and low libido, talk to your doctor about options like localized estrogen creams or hormone replacement therapy.
HRT.
For more immediate relief from dryness, especially during intimacy, water-based lubricants or vaginal moisturizers can be a game changer. They increase comfort and can lead to more positive sexual experiences, which over time can boost desire.
It's about creating a more pleasurable experience overall.
Exactly. And finally, our source talks about the potential of vaginal probiotics.
Probiotics, like the good bacteria.
Yep, specifically targeted for the vagina. A high-quality vaginal probiotic can help replenish and support those beneficial lactobacillus bacteria we talked about.
The little warriors.
Exactly. By restoring and maintaining that balance, it helps maintain that healthy acidic pH, which is your natural defense against the bad guys. And that can mean less inflammation and irritation in the vaginal tissues.
Less discomfort. That's always a good thing.
Right. And here's a key point, especially when it comes to low desire. Proactively addressing those underlying causes of discomfort, it can do wonders for your sense of well-being and body confidence. It can reduce anxiety around intimacy and even help rebuild desire.
So it's not just about the physical symptoms, it's about the mental and emotional impact as well.
Exactly. It's about creating that sense of, I feel good, I'm comfortable in my own skin, which can make a huge difference in your desire for intimacy.
Okay, so it's about nurturing a healthier internal environment.
Precisely. And speaking of which, our source mentions a specific product called Balance Complex.
Balance complex. Tell us more about it.
So it's described as a scientifically formulated vaginal probiotic. It's designed to restore that crucial microbial balance, reduce inflammation, and support your natural defenses down there.
Sounds like it's tackling those key issues we've been discussing.
It is, and it's important to note that those things, the microbial balance, the inflammation, they can be affected by things like estrogen fluctuations and chronic discomfort, which, as we know, can contribute to low desire.
It's all connected. What are some of the things that make Balance Complex stand out?
Well, it's been around for a while, so it has a pretty good track record. It contains a significant amount of live probiotics, including a blend of different strains. It also has cranberry extract and D-minnows, which are good for urinary tract health.
Ah, the urinary tract. We can't forget about that.
Definitely not. It's all connected. And it has a multi-strain formula that's designed to target those common concerns like odor, itching, and discharge.
Sounds comprehensive.
It is. And they mention it's non-GMO and made in facilities that meet high-quality standards.
Good to know. What about the specific ingredients? What's in it that makes it work?
So it's got a blend of various lactobacillus strains like Acidophilus, rhamnosus, Reuteri, plantarum, and Bacillus coagulans. Those are all included because they're known to support a healthy balance of vaginal flora, help with immune response, aid in tissue healing, provide antioxidant benefits, and maintain that long-term balance.
Those good bacteria are hard at work.
They are. And then you have the cranberry and D-minnows, which help prevent those harmful bacteria from sticking to the walls of the vagina and urinary tract.
Right.
There's also oregano leaf extract, which has antimicrobial properties, caprylic acid, which may help with yeast overgrowth, enzymes like protease and cellulase, which break down bacterial biofilms, aloe vera leaf for soothing and reducing inflammation, arabinogalactin to boost the immune response.
Wow, that's a lot of ingredients.
And there's more. Anise seed, which is antimicrobial and anti-inflammatory, black walnut hulls, which are antifungal and antibacterial, wormwood, which supports immune resilience and balanced flora, and reishi mushroom, known for reducing inflammation and supporting tissue healing.
It's like a whole army of good stuff going in there.
It really is, and the idea is that all of these ingredients work together to create a healthier vaginal environment.
So how does Balance Complex specifically help women who are experiencing HSDD?
Well, by restoring that microbial balance, it can help prevent the overgrowth of those problematic bacteria and yeast that can lead to irritation and discomfort. The anti-inflammatory ingredients can help soothe the tissues, potentially easing dryness and discomfort. And by fostering a more balanced environment, it can help prevent those recurring infections that can be such a barrier to intimacy.
So it's like it's creating a more resilient environment down there.
Exactly. And when you're not dealing with constant discomfort and irritation, that can translate to increased comfort and potentially even a renewed interest in intimacy.
It's about setting the stage for more positive experiences.
Exactly. So taking care of your vaginal health with something like Balance Complex can be a really important part of a broader approach to sexual wellness.
It's not a magic bullet, but it's a piece of the puzzle.
Exactly. While addressing any underlying emotional, psychological, or hormonal factors is crucial, proactively supporting your vaginal health is a tangible step you can take. By creating that stable, comfortable, and less infection-prone environment, you're setting yourself up for success.
You're taking control of your own well-being.
Exactly. And Balance Complex seems to be designed to support that holistic approach.
So to recap, it seems like for some women dealing with HSDD, paying attention to vaginal health could be a really important part of the journey towards boosting their libido.
Absolutely. It's about addressing those chronic discomforts, the dryness, the recurring infections. Those can really impact desire.
And by taking those proactive steps we talked about, whether it's lifestyle changes, gentle hygiene practices, supporting your immune system, or even trying a targeted probiotic like Balance Complex, women can really take charge of their sexual well-being.
They can regain that sense of comfort and confidence, which can make a huge difference in their overall experience.
It's important to remember that everyone's journey is different. There's no one-size-fits-all solution.
Definitely.
But making that conscious effort to prioritize vaginal health, that's a powerful step towards better sexual wellness.
I completely agree. And for anyone listening who has concerns about HSDD or their vaginal health, I always recommend talking to a healthcare professional. They can provide personalized guidance, especially if you're dealing with more complex or persistent issues.
Absolutely. And if you're curious to learn more about your own vaginal health, our source mentions a website called vaginalquiz.com.
Oh, interesting.
Yeah, it's vaginalquiz.com. It's a quick, science-backed quiz that can give you a personalized analysis in just a few minutes. It can help you understand potential imbalances and offer suggestions tailored to your specific symptoms and lifestyle.
That sounds like a really great resource for anyone wanting to learn more.
Definitely. So as you think about your own well-being and your relationship with intimacy, ask yourself, could prioritizing your vaginal health be the key to unlocking greater sexual well-being and a more fulfilling, intimate life? It's a connection worth exploring.
I think that's a great takeaway for our listeners today.
It's all about taking charge of your health and happiness.